Okay, so we're going to talk about limb deformities in foals specifically, so baby horses. And there are two types, angular ones and flexural limb deformities. So angular ones, it's basically what it means is there's like a deviation of the limb in the frontal plane, and that's what we call an angular limb deformity. In flexural ones, it results in either hyperflexion or extension. So let's talk about types of angular limb deformities. There's first valgus. So it sort of could look like this, like let's call it a triangle shape. So what you get is a lateral deviation of the distal limb to the point of origin, and this is referred as a valgus deformity, so VALGUS. And what you get is an outward rotation of the feet. So what you get is also a splaying foot or wide feet stance. So it's not just a wide feet stance, but like it's not just your foot's going out, but it's sort of there's a rotation there outwards. Varus, so not valgus, varus. So varus is sort of the opposite. It's a medial deviation of the limb, distal to the point of origin. So what that means is like this is the point of origin, this is distally, and it's referred to as a varus deformity. And what you get is an inward rotation of the feet. We describe this as being pigeon-toed. So this time it's not just like your whole limb is being turned this way, but also like your foot is rotated that way. And where does this come from? Well, basically in the cuboidal bones of the carpus or tarsus bones, tarsus region, and in the epiphyseal region of the long bones. What does this mean? So the ends of long bones are like, let's say, if we ignore these bones here. So yeah, long bones like the epiphysis, physes, and metaphyses, and rarely in the diaphyses of the long bones, so the middle. And the edges of the small bones are still somewhat rounded at birth, but the carpal and tarsal bones should be adequately like ossified, meaning they should be hardened with enough calcium. And so there are some perinatal factors. So you can see they're not ossified properly in the carpal tarsal region. So there are a variety of effects that can occur in the mare that can jeopardize basically the intrauterine environment of the foal, which leads to incomplete ossification of the carpal and tarsal bones at the time of birth, such as prematurity, like shortened gestation. So if it's less than 320 days, that's what we call a premature foal. Abnormal uterine positioning, dysmaturity, maybe because of placentitis, placental insufficiency, let's say metabolic diseases like maternal malnutrition, parasite infestation, colic and shock, of course, are not good because they can alter the blood supply to the uterus. Chemical insults like vaccinations, antihelminthics, and they can influence basically the fetal development. You have also thyroid abnormalities which influence ossification. Yeah, this isn't good, is it? So you can also have laxity of the periarticular structures. So basically the articular regions, there's a lot of laxity there. They're really flexible, and it's caused by a hormonal imbalance or by intrauterine positioning. It also shows it here. So what happens is you get aberrant intrauterine ossification of the distal physeal region of metacarpal or metatarsal 3. And this is are involved, and it forms a triangular epiphysis with the fetlock joint, varus. So we mentioned varus is, let me show you again. So varus is the medial turning. Okay, let me zoom out. So you also have acquired or developmental factors. They can, these occur because of disproportionate bone growth, like genetic issues, dietary imbalances like excessive grain intake, not enough copper, too much zinc. So let's say that again, too much grain or zinc or too little copper. Sometimes even trauma like with exercise, physical overload, heavy birth weight, which results in microfractures and crushing of the proliferative zones of the physis, and you have physical dysplasias. You can see like the bones aren't really properly ossified. And this occurs on farms with a high occurrence of ALD or feeding practices issues. And I think we'll call this the last slide before we move on. So what we do is we go through 3 steps: the observation, the palpation, and the Roux parameters. So the Roux parameters are those like measurements we mentioned, and laminitis. So observation, the foal is observed at rest, and the clinician should be positioned, so let's say perpendicular, so I should be here, that's where the vet should be, to the frontal plane of the examined limb. And with a valgus deformity of the carpal region, what you'll see is it should be evaluated perpendicular to the frontal line of the outward rotated carpus. If the toe points in the same direction, the entire limb is rotated out. And normally for a newborn foal, we can do surgery or maybe postpone the surgery, but surgery is usually required now. If the carpus points are outward, but the toes point straight forward, so the toes are pointing this way, a varus deformity of the distal limb is present and may go unnoticed for a few months, but surgery is required in both of these cases. Valgus pointing out with varus pointing in. So you can see even the direction of the toes are going this way. So that's why you have to be perpendicular. And we'll go into more of it soon. Next step will be palpation. Actually, no, let's finish this. Okay. So palpation, what are we trying to feel? It helps to differentiate between most perinatal and developmental deformities. So what you do is you apply manual pressure on the medial aspect, so on this side of the carpal region, to straighten out a valgus deformity, because the cause is laxity of the periarticular supporting structure, so this is going to be flexible. If the limb can't be straightened with manipulation or changes of the osseous structures of, changes of the osseous structures of the region are involved. Next, we also have x-rays. They provide the only objective evaluation of deformity, as you saw there. So you do a dorsopalmar view. So just imagine the horse is in front of you. You take a photo from the front of the horse, and you look at the tibia and the third metatarsal bones. And if they're not in alignment, so you can see there's it's a bit mishmash here, you will see an angle of 5 to 7 degrees is normal. So an angle of 5 to 7 degrees is normal. This isn't normal. And it also says you need to include as much of the bones proximal and distal to the deformity as possible when you're taking your photo. So, you need to include some of these bones just to compare the periarticular surface area around these small cuboidal bones. And what you'll see, you'll draw 2 lines through the axis of the long bones, and the bisection of the lines, which is known as the pivot point, represents the origin of the deformity. The angle is formed by bisecting the lines, and this is known as the pivot point angle. The degree of the limb deviation can be determined, and it can be determined whether the deviation originates in the joint or in the physis, so, in the epiphysis or the diaphysis. Finally, we have treatments, so we'll come back.